Hello guys, this is Lily and welcome to my YouTube channel. This is a reviewer in massage therapy video, and it will give you a list of questions and answers that will help you in your massage therapy review. Okay, so here we go. We have preparatory exam reviewer for a massage therapy student that is undergoing a review, or they can use this in their school, okay, for any test exams or for their preparatory exam in their school. Okay, so as you can see, we have a list of questions here. So the first question is, a massage therapist provides an intake form to uncover what treatment the client wants to achieve. So what does the RMT want to perform? So there's a list of answers here, and the A, B, C, D, answers are listed here. So for the A, it is a treatment plan. For B, an appointment policy. For C, an assessment. And for D, an informed consent. So the correct answer here is letter C, an assessment. Okay, so the question says, what does the RMT want to perform? The RMT wants to perform an assessment. So letter C is the correct answer. Okay, so the second question says here, when straight leg test is performed, to what degrees is applied to the most tension on the sciatic nerve roots when the leg is raised? Okay, so letter A, the choices here are letter A, more than 90 degrees, letter B, from 0 to 35 degrees, for letter C, from 35 to 70 degrees, and letter D, from 70 to 90 degrees. So the answer here is 35 to 70 degrees, letter C. Okay, so that's the answer for this question. Okay, the next question, number 3, what general type of joint is the knee joint? Okay, so we have a list of answers here. Letter A, fibrous joint. B, synovial joint. C, cartilaginous joints or cartilaginous joints, and D, none of the options. So the correct answer here is letter B. Okay, synovial joint. So I have here the the notes of all the choices on the question number 3. So just for an additional information for you guys, so I have provided you here the notes for all the joints, all the types of joints, as mentioned on the answers on question 3. So fibrous joint. Fibrous joints are connected by dense connective tissue consisting mainly of collagen. Okay, these joints are also called fixed or immovable joints because they do not move. Okay, so there you go, guys. It is immovable joint, or they are immovable joints. Okay, fibrous joint. Fibrous joints have no joint cavity and are connected via fibrous connective tissue. The skull bones are connected by fibrous joints are called sutures. Okay, so just to read on the next information on fibrous joint, and then we'll come to sutures. Sutures are immovable joints, which is also called synarthrosis, and are only found between the flat plate-like bones of the skull. There is limited movement until about 20 years of age, after which they become fixed and immobile. Okay, they are most important in birth, as at that stage, the joints are not fused, allowing the formation of the skull as it passes through the birth canal. Okay, so there's gymphosis. Kyphosis are also immovable joints. They are found where the teeth articulate with their sockets in the maxilla, upper teeth, or the mandible, lower teeth, and the tooth is bound into its socket by the strong periodontal ligament. Okay, so the sutures, the gymphosis, the synostomosis are joints, are classification of fibrous joints. Okay, now the syndesmosis are slightly movable joints. They are also called amphiarthrosis. They are comprised of bones held together by an interosseous membrane. Okay, the middle radioulnar joint and middle tibiofibular joint are examples of a syndesmosis joint. Okay, so let's discuss about synovial joints. So a synovial joint is defined by the presence of a fluid-filled joint cavity contained within a fibrous capsule. They are freely movable. Diarthrosis is also called diarthrosis and are the most common type of joint found in the body. Okay, so synovial joint are the most common found joint in the body. It's also known as diarthrosis. Synovial joints can be subclassified into several different types depending on the shape of their articular surfaces and the movements permitted. Okay, so take a look at this guys. So there's hinge, saddle, plane, pivot or condyloid, and there's the ball and socket, which is the familiar one. Okay, so take a look at this, guys. These are these sub-classification of synovial joints. So hinge, saddle, plane, pivot, condyloid, ball and socket joints. Okay, if you're gonna see this picture, all of these joints you can see here in this picture. Just take a look at it. Okay. Now let's discuss about cartilaginous joint. In a cartilaginous joint, the bones are united by fibrocartilage or hyaline cartilage. There are two main types: the synchondrosis, primary cartilaginous, and symphysis, secondary cartilaginous. Okay. So synchondrosis joints, the bones are connected by hyaline cartilage. These joints are immovable or synarthrosis, and an example of synchondrosis is the joint between the diaphysis or epiphysis of a growing long bone. Okay, and the symphysial joint are where the bones are united by a layer of fibrocartilage. They're slightly movable, amphiarthrosis. Example include the pubic symphysis and the joint between vertebral bodies. Okay, so guys, take a look at this picture. There's the vertebral body, and there's the vertebral disc, intervertebral disc. Just take a look at this picture. Okay, so the fourth question here says here, before a massage therapist begins the massage treatment, what is the primary consideration? Okay, so we have four choices here. Letter A, we have to check for any contraindications that are present. B, make sure to wash hands thoroughly. C, make sure that the client is comfortable. They make sure that no jewelry is being used by the client. The answer here is C. The answer here is A. So A, check for any contraindications that are present. Okay, that's the answer for question number 4. Okay, so question number 5. Client comes in with numbness, tingling sensation on thumb, index finger, with pain on flexion and extension of the right forearm, and unable to grasp paper when pulled away. Which special test is best to determine the client's discomfort? Okay, so letter A, Valence Test. B, Tenel sign on top to post medial elbow, the ulnar nerve between medial epicondyle to olecranon process. C, Fromits sign. And D, reverse Valence test. The answer here is C. That's the correct answer, Fromits sign. Okay, so I have here a note, okay, of all these tests on the choices for you guys, to help you guys determine know the tests. What are these tests? Okay, so just to give you insights on or information of all these tests. Okay, so there you go. There's Valence test. Valence test or Valence test is a provocative test used in the diagnosis of carpal tunnel syndrome, the CTS. This occurs when the median nerve is compressed or squeezed at the wrist. Okay, so it's about the median nerve. Okay, the Valence test testing the compression of median nerve at the wrist, okay, of our arm. The pain is often worst at night. Daily activities such as driving and typing may increase the symptoms. Okay, so you guys, there's other information about Valence test, so let's go forward to Fromits sign. Fromits sign is a physical examination of the hand to test for palsy of the ulnar nerve. So it's focusing on ulnar nerve for Fromits sign, which results in reduced functionality and muscle weakness of the pinch grip. It tests the strength of the adductor pollicis of the thumb. It is pollicis, which is innervated by the ulnar nerve, and it is weakened in ulnar nerve palsy. You guys, so this is the Fromits sign. It is testing for ulnar nerve. So when you use your thumb and your index finger to grab a paper, then you'll see the abnormality of the when it's gripping a paper, the thumb and the index finger cannot hold the paper, cannot grip it. So there's a problem in with the ulnar nerve, because the ulnar nerve is controlling the thumb, controls the thumb. Okay, the muscles, and that is innervated by the ulnar nerves. Okay, so next is the Tenel sign. Tenel sign is the sign that the nerve is irritated. Okay, so Tenel sign is positive when lightly banging, percussing, okay, over the nerve elicits a sensation of tingling or pins and needles in the distribution of the nerve. So if you do percussion on the area and you feel some numbness and tingling sensation, then you know that the nerve on the area is irritated. Okay, that's a sign. That's why it's called Tenel sign. Okay, and for example, in carpal tunnel syndrome, where the median nerve is compressed at the wrist, the test for Tenel sign is often positive, eliciting tingling in the thumb, index, and middle fingers. Okay, here you go, guys. Okay, the next one is the reverse Valence test. The patient maintains position of full wrist and finger extension for 2 minutes. Okay, in this test, that's what you're gonna do. Okay, the client on the carpal tunnel increases after 10 seconds compared to 20 to 30 seconds for the standard Valence test. The longer the position is held, the greater the pressure on the wrist and carpal tunnel. All right, so next question is question number 6. The question number six is, if client presents with hyperkyphosis, what will you not do? Okay, so the choices are: A, decrease hypertonicity on pectoralis muscle. Hypertonicity is tightness on the pectoralis muscle, which is the breast muscle. Okay, B, strip through rhomboid. So do stripping techniques on the rhomboid muscles, which are the muscles on the mid back, okay, between the vertebrae and the scapula. Okay, so that's where the rhomboids muscles are. Okay, so you do the stripping. It's a Petri-Sage deep technique on the rhomboids. Letter C, decrease hypertonicity or on supraspinatus muscle. So you should reduce the tightness on the supraspinatus muscle. Supraspinatus muscle is one of the rotator cuff muscle. It's located on the upper portion of the scapula. Okay. Letter D, decrease hypertonicity on erector spinae muscle. So decrease again to reduce tightness on the erector spinae muscle. Erector spinae muscle is located in the lower back. It is the muscle just on the lower back, and it's located bilaterally on both sides, just attached to the the lumbar, the lower back vertebrae. Okay, it's just the side of it. That's the erector spinae muscle. So the answer to this question, what will you not do when your client presents with hyperkyphosis? Hyperkyphosis is a condition or a problem where the mid back is protracted or curved towards outward. Toward the back is curved. It's like a the rib cage is abnormal, so there's a curve. Okay, so the answer to this is B. So since it's the mid back is curved, that's where the rhomboid muscles are located. So you don't do stripping because that's a deep Petri-Sage technique. And what you're gonna do, the muscle there is weak because it's lengthened due to protraction. So you're not gonna do any deep massage. You're gonna stimulate the muscle because it's weak. So you just need to do some tapotement, light tapotement in there to stimulate the muscle because it's weak. So you don't need to reduce the tightness because the muscle there is not tight. Okay, good. Okay, so I have here the notes giving you some information about all the muscles that are on the choices. So we have here the pectoralis muscle. So just read on this information. Okay, we have here a picture of the muscles. So you can see the deltoid, pectoralis major, that's the muscle, and latissimus dorsi, muscle, biceps brachii, brachioradialis. So you can see the pectoralis major is the biggest muscle on the breast area. Okay, the green part, that's the pectoralis major muscle. Right, so you can see the origin and the insertion of the muscle the pectoralis muscle, and the actions of the pectoralis major muscle. You can see it here. So take a look at the information here, guys. There's a picture here too, so you just have to take a look at it. You're gonna see the lateral pectoral nerve and the medial pectoral nerve, the nerve innervation of the pectoralis muscle. Now we'll proceed to the rhomboids. So I was talking about the rhomboids is situated bilateral on both sides on the mid back. Okay, so there are information here. Just take a look at this and read the information. Okay. Additional information about the rhomboid muscle, the origin, insertion, the action, the innervation, the blood supply are all in here. So just read on this. Next is we're going to discuss about supraspinatus muscle. So like I said, it's one of the rotator cuff muscles. It's located on the upper portion of the scapula. So there are information here and a picture. Just take a look at it. Okay, the origin, the insertion of supraspinatus muscle are in here. So the information, just read on this. Okay, so the actions of supraspinatus muscle, the innervation or the nerve innervation are here. So take a look at it. There you go. There's the scapular nerve on this drawing. Just take a look at it. Now the erector spinae muscle, which you can see, or it's located on the lower back, the lumbar area of the vertebrae, just beside it. It's attached to it, the erector spinae muscle. Just there are information here. Just read on this. Some more information about the erector spinae muscle. Okay, just take a look at it. There's a mnemonic here on the very edge of this page. I like standing stands for iliocostalis, longissimus, and spinalis. So I like standing, the mnemonic. So you can remember the muscles that are forming the erector spinae muscle. Okay, so here's the drawing of the erector spinae muscle. So the iliocostalis, the longissimus, and spinalis forms this muscle. Okay, just take a look at it. That's how it looks like, guys. It's just by the vertebrae. Okay, so the number 7 question. Poor footwear and an abnormal gait mostly likely could lead to letter A, patella tendinitis. Patella is the bony prominence on your knees. Okay. B, decurvent stenosynovitis. So it's a kind of inflammation on the somewhere on the thumb area, thumb and the dorsal surface of your thumb. Letter C, Achilles tendonitis, inflammation of the tendon on your Achilles, the Achilles tendon that's on your by the heel bone. Okay, that's where the Achilles tendon is found. Letter D, the supraspinatus tendinitis, still inflammation of the tendon of your supraspinatus muscle. Supraspinatus, like I said, it's located on the upper portion of your scapula. It's one of the rotator cuff muscles. Okay, so I have here the answer is the Achilles tendinitis. That's letter C. If you have poor footwear and an abnormal gait, that's the Achilles tendinitis. That's the answer. Okay, so I have here some information about all the choices, and just take a look at this. So we have here the patellar tendinitis, all information about it. Okay, just read on this. All right, the patellar tendinitis. Now we have the decurvent stenosynovitis. Okay, still an inflammation, and just we have here some information. Just read on this and take a look at it. Additional information of decurvent stenosynovitis. Just read on this. Now we have the Achilles tendonitis. There are some information here, and just take a look at it and read this. Now here is a picture of the Achilles tendon. So you're gonna see where the Achilles tendon is located in your foot. So it's just by the it is attached to the heel bone. Okay. More drawing for the Achilles tendon. Okay. You can see there's like a thickened and generated tendon. That's where you can see like a swelling, a swollen area. And then there's the heel bone. Okay, so there are other information here about the tendinitis, the Achilles tendinitis. So just take a look at it. Here you go, another picture of the tendon, Achilles tendon, calcified and degenerated tendon insertion. Okay, there are other information for the Achilles tendinitis. Just take a look at it. Then you go the supraspinatus tendinitis. The information about this, just read on this. The next question is question number 8. Client has condition of autoimmune to the myelination of peripheral nerves. What condition is this? Okay, so the choices are letter A, multiple sclerosis or the MS, letter B, the ALS, letter C, the Guillain-Barré, letter D, rheumatoid arthritis. So the answer to this is multiple sclerosis. So I have here a note, and that will explain everything here on the choices. So for the multiple sclerosis, here you go. So just this information are about multiple sclerosis or the MS. So just read on this. Okay. So we have here the multiple sclerosis as well, additional information, and how it looks like, the nerve, as you can see in this picture, the bottom nerve is the affected nerve for MS, the MS, the multiple sclerosis condition. The upper part is a normal nerve or a healthy nerve. Okay. Okay, the ALS or the amyotrophic lateral sclerosis, we have the information here. Just read on this. Additional information of the ALS as well. Just read on this. Now we have the Guillain-Barré syndrome. Okay, so the information about this is here. Just take a look at it. Just read on this. Okay, the next question is question 9. Client has acute flare-up of rheumatoid arthritis. What would you do? Choices are A, ice, B, gentle ROM or range of motion to knee, C, frictions, D, fascia to hamstrings. Okay, so the answer to this is letter A. You apply ice. Okay, so we have notes here for each of the choices that you can read and get information from. Okay. More information about ice, and then we have the range of motion, and just the information is here, and read on this. Okay, you have just to take a look at this. Okay, additional information for the range of motion. Just take a look at it. More information for range of motion. Okay, we have the friction. There is the information here. Just read on this. additional information for friction. Just read on this. The techniques for friction, just read on this. Other information for friction, just read on this. We have here the myofascial release, so just read on this. The information are all here. Sorry. The next question is question number 10. From medial attachment of piriformis, what fiber direction? So we have the choices: anterolateral, posteromedial, and C, anteromedial, and D, posterolateral. So the correct answer is A, anterolateral. So I have notes here about the choices. Okay, just read on this. For anterolateral. For posteromedial, anteromedial, posterolateral. Okay. The next question is question 11. What questions would you ask client with diabetes mellitus or mellitus? 1. Okay. The choices are A, the injection site, B, juice okay to increase blood sugar, C, what brand of insulin the client is using, D, when was the last time the client takes insulin meds? So what would you not ask? Okay. The correct answer is letter C. You wouldn't ask the client what brand of insulin the client is using. Okay. So in the questioning, you should be very cautious about what is asked. If it says you do not ask, so you should be careful about understanding the question in your exams. Okay. So I have here the notes about diabetes mellitus or mellitus. Just read on this. It's about the blood sugar with somebody having diabetes mellitus 1 condition. Just read on this. Additional information. We have here the insulin, so just read on this. And the types of diabetes, so we have it here as well. Just read on this. Okay, type of diabetes, we have the diabetes type 1. Okay, just read on this. We have the type 2 diabetes, so just take a look at this information. There's obesity information for diabetic person or client. Just read on this. There's a list of complications of diabetes. Just read on this. Other information of diabetes, so just read on this. The next question is question number 12. Client comes in with a note from a doctor, has foot drop, and has common peroneal nerve lesion. Where would you do work? Okay. The choices are A, anterior tarsal tunnel, B, posterior to medial malleolus, C, posterolateral to knee, D, anteromedial to knee. So the answer is letter C, posterolateral to knee. Okay, just have some notes here. Just take a look at it. Okay, so what is foot drop? There are information here that I would like you to take a look at it. Causes of foot drop. There is nerve injury, muscle or nerve disorders. Okay, we have brain and spinal cord disorders as well. We have here the common peroneal fibular nerve. Okay, so just take a look at it. Here's a picture of the nerves and the muscles as well, so just take a look at it. The next question is question 13. What question would you ask a client with multiple sclerosis or the MS? Okay, A, intolerance to heat, B, position for comfort, C, improvement for poor circulation, D, tolerance to pressure and pain. Okay, so the correct answer to this is letter A, intolerance to heat. This is the question that you would like to ask a client with multiple sclerosis. So the answer is C. Here's a note about multiple sclerosis. Just take a look at it. We have symptoms for multiple sclerosis. Just read on this. Still additional information about MS, multiple sclerosis. Okay, the next question is question number 14. Where do blood vessels, nerves, and ureters enter and exit the kidneys? Okay, so we have the choices here. A, hilum, B, renal medulla, C, renal cortex, D, renal pelvis. The answer is A, the hilum. Okay, that's where the vessels, blood vessels, nerves, and ureters enter and exit the kidneys. Next question is question number 15. Which of the following statements about the kidney is false? Okay, A, the renal pelvis drains into the ureter. B, the renal pyramids are in the medulla. C, the cortex covers the capsule. D, nephrons are in the renal cortex. Okay, so which of the following statement is false? The correct answer is letter C. Okay, now next we're going to go to question number 16. Which of the following statements about the nephron is false? So we're looking at false statement. A, the collecting duct empties into the distal convoluted tubule. B, the Bowman's capsule surrounds the glomerulus. C, the loop of Henle is between the proximal and distal convoluted tubules. Yes, that's correct. The loop of Henle empties into the distal convoluted tubule. That is true as well. Okay, so the only answer here that is false is letter A. The collecting duct empties into the distal convoluted tubule. That is false. Okay, so the correct answer is letter A. I have here some notes that I would like you to take a look at it. These are the notes about kidneys and other tissues surrounding or within the kidneys. So all information about the kidneys, just read on this, guys. I have here a drawing of the kidneys in the body, so just take a look at it. Information about the kidneys, so just additional information, just read on this. We have here function of the kidneys, so we have waste, excretion. So just take a look at it, read on the information, guys. We have reabsorption of nutrients, that's another function of the kidney, so just read on the information. We have the maintaining of pH balance, just read on this, guys. So other information about the kidney, just take a look at it. Another function is osmolarity regulation, so the kidney regulates osmolarity. Okay, the body's electrolyte water balance, the kidney regulates that. Another function is regulating blood pressure. Yes, the function of the kidney, it regulates blood pressure. Information about this, just read on this. Secretion of active compounds, so another function of the kidney. So we have here information, just take a look at it. There's a drawing of the kidney, and you can see all the components or the parts inside the kidney. Just take a look at it, guys. Okay, this is how the kidney empties into the bladder. Okay, so from the kidney into the nephron, these are inside the kidney, and inside the nephron we have here this the Bowman's capsule, the loop and Henle. These are the information. Just take a look at this. Okay, so it looks like the tube. Other information about the parts of the kidney: the renal pelvis, the hilum, the renal hilum, the medulla, renal medulla, or the renal cortex. Just read on this information, guys. We have here the glomerulus filters your blood, so read on this information. We have the renal corpuscle. Just read on this information as well. We have the renal tubule. We have the information about it. Just read on this, guys. And we have the capillary network within the nephron. So this information, just read on this, guys. Okay, so here we go. This ends our video for today. Thank you for watching. I hope this test reviewer will help you in your exam review in school, or with your board exam in the after your massage therapy course, after you have graduated. And please subscribe, and I hope to see you on my next video. You have a great day.